Hey everybody, welcome back to another edition of Byline with Ben Dennis. Yours truly here, looking forward to the Christmas holiday. Not because of the sugar cookies, and not because here in DC and on the East Coast, we're not getting snow. In fact, we're going to be getting rain, but because we're spending some time with family. I'm excited to go up to Pennsylvania where my folks are. I'm excited about this week's interview. We are diving into the looming healthcare crisis. Premiums set to skyrocket in 2026. It's not good news. I'm not the bearer of bad news, but we're trying to extrapolate how we got here after the Affordable Care Act was passed some 15 years ago. Republicans since then saying that they wanted an alternative. They still not have provided one that is tangible enough for lawmakers to consider en masse. We'll get to that in a moment. But also what folks can do right now in order to possibly lessen the burden if they are going to be facing hundreds of dollars more in premium costs. My interview is with Kitty Richards. Kitty Richards was working at the United States Treasury Department under the Biden administration. We talk about where we are going into January, where these Obamacare tax credits are going to be coming to the fold once again. They were not extended, which is why these folks who are utilizing insurance plans on the ACA marketplace are facing this problem come 2026. How it can be fixed, what might be discussed in the new year when Congress comes back into session in order to possibly fix this looming problem. Could the Republicans come back and Santa gives them a Christmas gift of a brand new health insurance plan? Time will tell. We dive into that. Also, we're going to talk a little bit about the Epstein files. They were produced en masse, if you will, plenty of documents by the Department of Justice on Friday. They faced a deadline from Congress, passed a law that said you have to release everything that was related to investigations, redacting names of victims, etc. We'll dive into that because they didn't release everything, and Republicans and Democrats are upset. We're also going to dive into the so-called Patriot Games, where athletes from different states supposed to come together and compete. Think of Hunger Games, but without the death, right? We're not going to do that. We don't condone that. However, I'm curious to see if it's politically related, if it may be a brand new athletic experience that happens in years to come. Who knows? We're going to talk pop culture too. Year in review, a lot has happened, whether it was politics, entertainment, lifestyle, education, sports. Can't forget about it as we are headed into the college football playoff season. But I'm excited to dive into this conversation with Kitty. So let's get to it. Joining me now is Kitty Richards. She is a fiscal and economic policy expert, former Biden official with the Treasury Department. Kitty, I appreciate your time to join during the holiday season here on Byline. Thank you.
Really glad to be here. Thanks for having me.
So for some of us who are just getting introduced to you, take me through what your role was like at the Treasury Department at the time before we dive into this, looming healthcare crisis.
Sure. So at the Treasury Department, I actually administered the state and local fiscal recovery funds, which was a $350 billion program from the Recovery Act during the pandemic that went directly to cities, states, counties, territories, jurisdictions all across the country to help them deal with the decline in their tax revenues caused by the economic crisis around COVID, and help them provide all sorts of COVID relief programs to their citizens. So that's what I was doing at Treasury. I also have been a long-time student of tax and budget policy, both at think tanks here in Washington, D.C. I'm currently a senior fellow with Groundwork Collaborative and also in the Obama administration.
Forgive me for missing those portions of your lengthy resume. You certainly have professionally followed the money, which is a favorite term of us in the journalism industry. But let's really get to the meat and potatoes here of what a lot of families, millions of them, are going to be facing in 2026. Brand new year, setting our New Year's resolutions, but there's this so-called healthcare crisis. That might scare some people, be a head scratcher, but in layman's terms, what are millions of families going to be facing on January the 1st and thereafter?
Yeah, absolutely. Back in the Obama administration, Congress enacted and President Obama signed the Affordable Care Act, often called Obamacare, which extended health insurance to millions of Americans who previously hadn't had it through a combination of expansions to the Medicaid program, which is a state-run program that provides health insurance to very low-income people, and also the creation of these health insurance exchanges, where people who don't get health insurance through their employers or who work for very small employers and also don't qualify for Medicaid can go and purchase private insurance on the market. And those plans are regulated. They're guaranteed to be real insurance plans that will really pay for your health care when you need it. And they're subsidized by the federal government because health insurance can be very expensive. During the pandemic, Congress passed a large expansion to those subsidies because health insurance, while it was available on the marketplace, it was often still really unaffordable for people. Premiums can be $1,000 a month pretty easily, especially if you have more than one person on your plan. Family plans can be very expensive. And the subsidies weren't quite making up the difference for middle class Americans. We have what's called the enhanced premium tax credits. Those are those extra subsidies. And those really targeted both the lower income folks who were on the exchanges, especially people who should have qualified for the expanded Medicaid, but their states, largely, a small number at this point of Republican states, didn't decide to take up that program. So they were left without insurance options. They get enhanced subsidies through the enhanced premium tax credits. And then those more middle class people making more than the around $60,000 for a single person that previously was the cap on folks receiving subsidy, they also got to get some support in buying health insurance. And what that meant was that the number of people purchasing health insurance on the health exchanges nearly doubled from about 12 million people to about 24 million people. That's a lot of
Could
Americans.
that have been predicted at the time?
I think that it was an exciting surprise, to see all of those people be able to get health insurance who previously hadn't been able to get it. I think also seeing how important health insurance was during the pandemic and then how premiums have been increasing, that really showed the value of these enhanced subsidies. A lot of people who previously couldn't afford health insurance or wouldn't have been able to keep affording health insurance have really gotten that help. I do think that one of the things that was really interesting about the expansion was how many of those very low income people took up health insurance when the additional subsidy wasn't always that large. But going from having to spend $10 or $20 a month to having to spend $0 a month really helped a lot of, very low income people, some
Goes
of
a
whom
long
don't
way,
have bank
especially living paycheck
accounts.
to paycheck. And yes, good point
Absolutely.
as well.
Absolutely. And so this program was a really big success. It was originally enacted, however, as a temporary program to deal with the pandemic and make sure that people had health insurance. And those health insurance expanded subsidies are expiring on January 1st. And what that means is that all those 24 million Americans going into the exchanges, they are seeing their premiums skyrocket. And in fact, folks are already shopping for insurance. So open enrollment started in November. And, you have a couple of months to choose your insurance plan before it kicks in on the 1st of January.
And you got to do it before that deadline. Otherwise, you're out of luck.
That's right. You're not going to get continuous coverage. And what people saw when they logged in on the health exchanges was pretty shocking.
It was
We're
jarring.
talking about an average of more than 100%, so doubling of premiums on average for people. And for some folks, they're seeing increases of hundreds and hundreds of dollars a month, thousands of dollars a year. And, what that means is a lot of folks are going to go without coverage. So we had this great success of millions of Americans getting health insurance coverage. We're going to see probably several million Americans lose health insurance coverage starting on January 1 because they just can't afford it. And then other families are going to be making really hard choices about groceries and electric bills and whether they can roll the dice and see if their kids stay healthy for the year. And if they decide to get coverage, they're often going to be getting skimpier coverage, because it's a little bit less expensive and also just paying, again, hundreds of dollars a month more.
Some folks, even thousands of dollars. I've seen some reporting about that too. So there's a lot of finger pointing on Capitol Hill. Who's to blame? That's $1 million question. Obviously, a resolution needs to happen. This is touching households near and far, does not discriminate against party, right?
Yeah.
Republicans have joined Democrats and come out against House Speaker Mike Johnson, and they really want to get this issue resolved, but they've punted the football into the new year. They've gone home for recess. Right now, we're filming this on a Thursday. They went home a day early. So let me backtrack here. When was this issue really first identified? Or at least the focus was put on, we need to make sure that this is extended or solve it in a different capacity because we know it's just temporary.
Yeah, I think Democrats in Congress really started to put the spotlight on this issue over the summer, especially when the most immediate healthcare crisis we're facing is January 1st. But a reminder to your listeners that the big Republican budget bill that was passed over the summer had almost $1 trillion in cuts to Medicaid, that program for the lower income people and some middle class people in states that extended coverage. And that doesn't go into effect until January 1st of 2027 because they wanted to push it to after the 2026 election because they knew that people didn't support this and they didn't want to see a bunch of voters get kicked off health insurance. And then it really came to a head in late September when Congress needed to pass a funding bill to keep the government open. So the government shut down. Democrats were really arguing that this was an issue that was important enough that they couldn't vote for a budget bill that didn't deal with it.
Well, the government reopened, and by large cases, Democrats folded. They didn't get what they had wanted. Certainly, they brought the issue to light, and maybe that was what they had wanted, right? I'm sure there'll be books written about this specific shutdown. Who knows? But let me ask right now, was there any last-ditch attempt before Congress concluded their session right now to try and get something done, a different
Yeah. So,
focus?
I would agree that it's really unfortunate that the Democrats in Congress didn't stick firm and get what they were asking for. But what they did ask for in exchange for eventually reopening the government was a vote in the Senate on extending these subsidies. They had that vote. It failed because it didn't meet the 60 vote threshold because they didn't pick off enough Republicans to do that. So all the Democrats voted for it, Republicans didn't. And they also didn't allow it to pass with only 50 votes, and so dead in the Senate. In the House, there were ongoing negotiations because there are some vulnerable Republican members who really don't want to see their constituents paying thousands of dollars more for health insurance in an election year and who are concerned about those impacts. It's great to see some Republicans willing to cross the aisle to try to get something done. But as you noted, Speaker Mike Johnson is in charge of the Republican caucus and in charge of what gets to the floor and what doesn't. And so he was very firm. And, the majority of the Republican caucus is really very far away from where the American people are on this issue. If you listen to Mike Johnson talk, he calls it the Unaffordable Care Act and claims that these subsidies have broken our health insurance market and broken our healthcare system. And that's not where Americans are. And he's really back in the kind of let's repeal Obamacare days of
Well, here's the thing.
2010.
It's been 15 years. Republicans had said that they want to propose another plan. We remember in that debate with Kamala Harris, with Donald Trump, I was asked about a health care plan to replace Obamacare, and he says, I have concepts of a plan. So, you
Yeah.
know, you talk.
And, I'll say that on top of that, when they are asked, even in this debate, there was some conversation about, oh, well, we'll extend the subsidies, but we want to see reforms. And the kinds of things that the Republicans were proposing were just laughable, just unserious. Things like, oh, we're going to give people a little bit of money to put in a health savings account to replace, a $50,000 health insurance plan. And that's just.
Can you explain why that wouldn't be a good idea in your view?
Sure. It's a couple of things. One, the numbers just don't add up. And two, there's a real difference between having a little money in the bank and actually having health insurance. If something really happens to you, you get really sick, you get in an accident, those costs can be very, very high. And that's why we have insurance. It's because you don't know whether you're going to be one of the unlucky people who get sick next year. And so you buy insurance and everybody buys insurance, and the folks who get unlucky get sick. they have their healthcare costs covered. And all of these suggestions that we're going to find a way to spend much, much less and people are still going to be made whole, the numbers just don't add up. And it really leaves the people who really get hurt are folks who are lower income, folks with families, and folks who are not as healthy. And I think that's a really terrible thing to be imagining. A lot of folks on the exchange are, for example, they're entrepreneurs. They work for themselves. They don't get insurance through their employer. And some of them are older. Some of them are, in their late 50s, in their early 60s. They don't yet qualify for Medicare, which starts when you're 65. But their health care costs can be very high, and they've been working their whole lives and paying into the system in various ways, and to suddenly be denied access to health insurance and told, we're going to set up a system where you get a little tax break for money you put aside for next year's healthcare costs, that's just not a serious proposal.
We can have a separate conversation about Social Security and whether our generation might be tapping into that at some point as well. But let me ask you this. If Obamacare would be replaced, if Republicans want to get that box checked that they have said for 15 years, it feels like an eon at this point, what would possibly be a good replacement?
I mean, I think part of the problem is that the Republicans in Congress do not believe that the government should help people have health care. And so that ideological opposition, and it's not true of all of them, as we've seen, some of these vulnerable members, more moderate members, but it is disingenuous to claim that you want to fix the system or replace Obamacare when really what you want is for people to have to buy their own health insurance on the market, not get support from the government, and have to kind of go it alone and roll the dice.
Well, at
And
that point,
so
do you think it's incumbent on the health insurance companies to have a little bit more empathy? I see you have a book behind you that says Empathy Economy. They have a role in this too, right?
I mean, I think that our whole system is, we spend more on healthcare in this country than any of our peer nations by like a factor of two. And there are costs that could be pulled out of the system. We pay more for pharmaceuticals. We have private health insurance that is profit oriented. We have for-profit healthcare. There are a lot of administrative costs to having all of these health insurance companies. That's not the way that other developed countries run their systems. And so I think there are a lot of serious proposals for thinking about how to go from spending nearly 20% of our economy on health care and getting worse outcomes than folks in other countries to bringing that down so that people can have that in increased wages and a growing economy. But none of them involve just saying most Americans just aren't going to be able to afford health insurance. And then maybe it'll get a little cheaper.
So say we come back January the 1st or whenever Congress, I haven't looked at the actual congressional calendar, if you will, in the new year. However, if the consensus does not come about just to extend these credits, is there a different scenario that might happen that you think possibly Democrats might sign on to? Or is it's just going to be debated on and on and on, and extending these credits are going to be inevitable? We just don't know when.
I think it's going to be really hard to tell how things are going to play out. I would not have predicted 2 days ago that multiple Republicans in the House would cross the aisle to sign a discharge petition. So for your listeners, this means if you can't get the speaker to hold a vote on something, if you get a majority of House members to sign a petition saying we want to vote, you can get a vote held on the floor. So, we did actually see several Republicans cross over to sign that discharge petition for a 3-year extension. I'd rather see these made permanent, but 3 years is certainly better than them expiring next January. Fortunately, one of the big problems with kicking the can down the road is even if they were able to pass this expiration in January, millions of people have already signed up for health insurance under the new premiums, or, as you said, failed to sign up for health insurance, and now they don't have coverage in January, and you can't unring that bell fully.
Unless you hold the health insurance companies to account, right? But would you see a world where that possibly happens, or is the lobbying arm just so strong that it's probably not going to happen?
I mean, I think that the health insurance companies will take the additional enrollees if they can get them. Is uh, These subsidies are in the health exchange. They are for private insurance. I would love to see the United States act more like other developed countries and consider having more public insurance options. But we don't have them. That would be one way to bring Obamacare costs way down, is with a public health insurance option on the exchange, so that something like an expanded Medicare program can compete with the private health insurers and bring those costs down. Because public health insurance is much less expensive than private health insurance. You see this in Medicare has some privatized plans that are called Medicare Advantage. They are more expensive and worse coverage in many cases than the traditional Medicare, or they use tricks to make sure that only healthy older people sign up for the Advantage plans, like offer you a gym membership, which isn't as valuable if you can't go to the gym because you're sick or in treatment for cancer. So having something like a public option on the exchanges or more public provision of healthcare could actually bring costs down. That's actually another interesting thing about these subsidies. Because many people are going to forego health insurance because they won't be able to afford it, the premiums for everyone else are actually going to increase in the private market.
That's what I wanted to
Because,
ask you. Yeah,
yep,
if you are getting health insurance from your employer right now, the conversation is about these Obamacare tax credits. Maybe you hadn't been utilizing them, but to your point, everyone's going to be feeling an impact.
that's exactly right. And that's because, again, I don't fault anyone who has to make the horrible choice to roll the dice and go without health insurance because they really can't afford it. But those people are likely to be healthier and have lower health care costs than the people who say, like, have to pay another $500 a month because my health care costs are higher than that. And so what that means is that those healthy folks who, you know, some of them will get sick and some of them will get in accidents and some of them will be bankrupted. But on average, they're going to have lower healthcare costs. And so when companies are setting premiums, they're going to say, we've got sicker people in the pool. Premiums are going to be higher. And the other thing to remember is if you do get really sick or get into an accident, we decided decades ago that we do not want to be a country where if you show up in the emergency room after getting hit by a car, someone checks to see if you have an insurance card in your pocket before they start to take care of you.
People will be sent to different hospitals, even if it's miles away, right?
So people will end up going to the hospital, and those hospitals will have to provide care, and then there won't be an insurance company to pay them back. And in cases of especially rural hospitals, many of which already operate at a loss, these cuts to health insurance, both through the exchanges and then the Medicaid cuts that are coming down the pike, they're going to cause some of those rural hospitals to shutter. And also, they're going to cause, in places where hospitals stay open, those costs are going to be paid by somebody. And they're going to be paid by folks with employer-sponsored insurance in higher premiums because the hospitals are going to need to charge more for care for people who can pay for it so that they can make sure that they can provide care for people who can't. And it's all totally unnecessary. These folks are people who today are covered by health insurance and good health insurance, and that pays their providers and their hospitals. So that's another kind of ripple effect that people, as you said, might not think, well, I get my health insurance through my employer, and so how is this really going to affect me? It's going to drive up costs. And if you're in a rural area or another place where you have a lot of folks who are covered by these public insurance programs or by subsidized Affordable Care Act insurance programs, you're going to see problems at your local hospitals and for your local doctors.
And the folks who are utilizing rural health facilities, largely these are in Republican districts too, right?
That is absolutely right. Also, the Affordable Care Act exchanges disproportionately impact folks in Republican areas, partly because, as I said earlier, the expanded tax credits helped folks who didn't get Medicaid eligibility because their governors were opposed to it ideologically. So it is this paradoxical thing for Republicans, and you saw it play out in the Senate debate. Places like Maine, Alaska, those are places with a lot of rural hospitals and a lot of folks who, need these subsidies.
Well, you mentioned two states that typically, well, have two senators that will buck their own party from time to time, Lisa Murkowski and Susan Collins as well. And to your point, during the Medicaid, the looming, or at least the Medicaid cuts, they came out in opposition of this. So I
Yeah.
understand your point. Let me
But
ask
it's
you,
difficult because, what they haven't done is gotten rid of the filibuster. And so, you can pass something, you can get 54 votes for something in the Senate and it still isn't passed into law.
well, President Trump just said on the South Lawn of the White House he would like to entertain the idea possibly of getting rid of the filibuster. As he says, we'll see what happens. I don't want to be doom and gloom here, and I want to get you out on this here. I really want to find some solutions here. Is there any practical advice that you can give someone who is facing hundreds of dollars, in addition, maybe thousands of dollars for their premiums, of what they can do possibly to lessen the hurt, if you will?
Yeah, I mean, I get asked that question a lot, and I also don't want to be doom and gloom, but this really is something that people need help with. People cannot solve this problem on their own. Your choices are you should certainly shop around for your health insurance. In many cases, what that's going to mean is buying a skimpier plan with higher out of pocket costs. But it's possible that going with a different carrier rather than just automatically re-enrolling with the folks you've used before, you might be able to save a little money. That's important to, when we're talking about this kind of money, it's important to check into that. Do make sure that you're really careful about looking at what kinds of things are covered by the insurance plans as you shop around, especially if you already have an illness that, requires a specific drug that's expensive, or where you really need to see particular doctors or specialists who you have a relationship with. You want to be really careful that you know how all the costs are going to net out in the end. You don't want to buy a slightly less expensive plan and then figure out that your out-of-pocket costs for your prescription medication for your asthma has doubled, and now you're paying more than you would have if you'd stuck with your plan. So that kind of careful shopping around, I think, is the best that folks can do.
Let me ask you this. Should people really consider some of these discount marketplaces, if you will, cost plus drugs? Mark Cuban, he has spearheaded this website where you can go and get generic brands of specific medication if you can there. Is that something that people should look at?
Yeah, absolutely. I think it is smart to try to be a smart consumer of healthcare. I myself have switched providers at times because even if I have decent insurance, I have to pay copays or co-insurance, and you get that bill and say like, oh my gosh, I had no idea that this provider was billing, $1,500 for this treatment that I could get for $300 out of pocket somewhere else. So, it's good to, and especially with those prescription drugs, which can be very expensive, thinking about not just assuming that things are going to be covered, not just assuming that you're going to get a good price, but it is hard. It's hard to get that kind of information, but it is worth doing for sure.
Kitty, I appreciate your time. Thank you so much.
Thank you.
Let's dive further into the headlines. The Epstein files came out, plenty of them, but not all of them. Last week, the Department of Justice is now facing a lot of pressure from Republicans and Democrats to get everything out there. They were required to, by law, to release these documents by last Friday. They didn't, but what have we seen thus far? High-profile figures, former President Bill Clinton, President Trump appearing in photos, other high-profile people that appeared, Michael Jackson, Diana Ross, you had Alan Dershowitz, lawyer, Harvard professor, Woody Allen popped up. I found it interesting. The one photo with Diana Ross, it was with Michael Jackson and also former President Bill Clinton, and they redacted the faces of what looked like young people. Well, we later learned that that photo included Michael's children and Diana's son. They're not victims of Epstein's, certainly as far as we know, but the Department of Justice still decided to redact it. It's not atypical, though, for the faces of children to be redacted in publicly shared documents from investigations. Also, news reports. We in the news business, if we're going out and get so-called B-roll, just stock video outside of a school, we make a habit to either blur the photos of children or just not shoot them at all, film them at all, because you need parental permission and you want to keep kids' privacy safe. But there was also a moment where the Department of Justice apparently scrubbed some documents they initially had published. One of them was of a desk drawer where President Trump was pictured with Melania, with Epstein, with Epstein associate Ghislaine Maxwell. And there was another photo in that same photograph that depicted this desk where Trump was photographed next to a collection of women. That was taken offline. Todd Blanche with the Department of Justice Deputy Attorney General went on Meet the Press, one of the Sunday shows on NBC News, and he had said that this is essentially adjustable. What's redacted, possibly. He teed that up by saying that if there is a victim who wants to come forward and possibly something was missed, we're going to review everything before it's, again, put out to the general public in order to protect the victims. But there's plenty of documents that they say still have not been released, despite them being required by law to do it. It seems like a Herculean effort. However, the DOJ has long said, and this specific Department of Justice, Attorney General Pam Bondi, that said that they wanted this information out there. The FBI said that they wanted this information out there. But then there was a lot of back and forth, especially notably, Democrats seized on that interview that Pam Bondi had, where she had said that an Epstein client list, if you will, the Epstein list existed. And then she said that there wasn't necessarily a list. Kash Patel, FBI director, has also gone back and forth from his days prior to being the head of the FBI. And what he has said sits. So it does not necessarily seem like this issue is going away, especially with more documents set to come out. We don't know exactly when, but keep an eye on it. Key questions here. What is in the unreleased Epstein files? What are we going to learn? Who's in it? Who might it implicate? More call logs. Will that be shared? Will a flight list, a more detailed flight list, come about? Some of these pages were so redacted that not a single piece of text was able for us to see. None of it. What's behind that? Who made the decisions to redact part of these documents? This is all something that lawmakers from both sides of the aisle have questions and are scrutinizing in this very moment. All right, America will be celebrating their 250th birthday in 2026. 250 years after 1776. There are many bipartisan events that are going to be scheduled. The America 250 Commission, it was a group that was approved before Donald Trump came into office for a second term, that was tasked with putting together events to celebrate America's birthday. They are continuing to do that. We now are facing a potential so-called Patriot Games, where a man and woman athlete from every single state, all 50 of them, will compete. There were plenty of comparisons to the Hunger Games. As I said at the top of this podcast, good news, there's no death involved. We're not endorsing any of that. So we'll have to see what the selection process will be like, what the games will be. Will it be track and field? Will there be swimming? Could it possibly be baseball, football, hockey, any other winter-related sports? Hey, yes, the Winter Olympics are coming up next year, too, in 2026 in Italy. There'll be a lot of pomp and circumstance, and certainly folks are already looking at the lineup for the opening ceremony, some top athletes that will appear. That's a separate conversation. But these so-called Patriot Games are tied to the 250th birthday for the United States. Is this something that was planned for long ago? Whose idea was it at its inception? Again, who might be selected? Where might it be hosted? How long might it last? Where might we be able to watch it? In person? TV? Oh, and yeah, follow the money. Who's going to pay for it? Famed director Rob Reiner and his wife Michelle were killed in their home last week. We talked about this on this podcast. Their son has been charged with their murder. But what we did not bring up last week was something that happened after this episode published, and that was President Trump's response to this. Got so much pushback from Republicans who typically do not come out in opposition of the president. They don't see that politically expedient for several cases. Democrats do that too. They don't necessarily come out and oppose their party leader for every single scandal, so-called scandal that happens. But President Trump had linked so-called Trump derangement syndrome to the reason that the Reiners were killed. Republicans came out swinging on this. Marjorie Taylor Greene, who we know recently has gone after President Trump for a myriad of different issues. She doesn't think he is keeping America first as he has promised, entering additional international conflicts, etc. But there were other Republicans that came out in defiance of what President Trump had said. I'm reminded of a previous episode on this podcast that I had an interview about. I talked with Peter Loge. He is a professor at George Washington University, but he also heads the Center for Ethics in Political Communication at that school here in Washington, D.C. I actually would like to get him back on Byline sometime in the near future. There was so much scrutiny about the ethics about this statement regarding the Reiners that crept into the headlines immediately following their murder. The Kennedy Center was also renamed. Got some brand new signage outside. It now says the Donald J. Trump and John F. Kennedy Center for the Performing Arts. The Kennedy family, with the exception of Robert F. Kennedy Jr., who is, of course, a cabinet secretary, head of HHS, they came out in fast defiance of this. They also argued, as many legal experts do too, Democrats as well, saying that it actually requires an act of Congress to make any name change. The initial reporting was that the Trump appointed board of the Kennedy Center unanimously voted for the name change, but one board member who joined this call, which happened reportedly at a, quote, residence in Florida, but also with virtual participants, at least one member of the board, who is a sitting member of Congress, said that she was planning to voice her opposition for this vote, but she was muted, and anyone who joined virtually was not able to chime in. This all comes after the Kennedy Center honors the rainbow medallions or rainbow sashes that connected to the honorees medallions were scrubbed this year. They now are blue. And the logo is already getting a name change too. The Trump Kennedy Center. Is this temporary? Will it actually last? Could Democrats, if they win the midterms in the House, possibly try and add hearings or add this issue to a hearing to the docket sheet in order to add to the conversation these questions about whether it was legal or not to just change the name of the Kennedy Center without the approval from Congress? We'll have to see. And then, of course, when President Trump is out of office, and if a Democrat comes into office, or possibly if a different Republican is elected president of the United States, might they turn the name back to the classic Kennedy Center? 2025 has been a sea change in pop culture, and I'm next week likely going to dive in on this after we go past the Christmas holidays. We get closer to New Year's, but an entertainment Super Bowl halftime show was announced. Bad Bunny. It's been a dominant year for mega pop star Lady Gaga, who's a personal favorite of mine. She is rumored to be a top contender for possibly Album of the Year for the Grammy Awards, among other top categories. Saturday Night Live had their 50th anniversary. Streaming platforms are increasingly top of headline for how people are consuming media these days, cutting the cable. Innovation in AI, the Labubu, you can name a myriad of different examples. I would like to get into that next week, and I'd be curious to hear from you. What were some of your notable pop culture moments in 2025 in politics, entertainment, sports, business, education, health? Chime in. I want to hear from you. We want to talk about it here on Byline with Ben Dennis. Keep it engaging, but I want to wrap it up right now. I hope everyone had a fantastic Hanukkah, the 8th crazy night, as Adam Sandler said years ago on SNL. Wrapped up Sunday night. I hope everyone had a festive time. It was so unfortunate that this came on the backdrop of that horrific shooting in Australia on I believe it was the first night, if not the first one or two nights of Hanukkah, where many Jews had gathered on Bondi Beach and were reportedly targeted and were shot at by these two men, apparently a father and son duo. Really sad story right in the middle of Hanukkah when there should be a lot of celebration going on. But I will leave it at that. I hope you enjoyed my conversation with Kitty, and please enjoy your time spent with family. I hope you're able to do that because Santa Claus also is coming to town, and I don't think he's done writing his naughty and nice list. So keep up the good work, everybody. We'll see you later. Take it easy.